name is Bishr Omary. I currently serve as the immediate past president of the AGA.
So could you give us a little bit of background on how you got into the medical field and also why you chose gastroenterology?
Boy, that's a so in the medical field. When I was going to college, I never ever thought I would go to medical school. I was a chemistry major, and then when I went to graduate school, I wanted to get training and become a scientist, so to get a PhD. So I went. Actually, it's kind of ironic. We're here in San Diego. I did my PhD at the University of California in San Diego. That was in chemistry. I was a chemistry major. And it was really during my kind of towards the end of my graduate work that I became interested more in biology, in fact, in disease, because part of my thesis dealt with looking at leukemias and lymphomas in terms of what's on their cells, on the surfaces of their cells that makes them act in a way that they're not supposed to act. So then I got interested in medicine. But my problem was that my GPA in undergraduate school was, I'm embarrassed to say, maybe when this is seen, but it might not mean anything, but it was 2.9, which is not good. Um, so I applied to medical school. I thought, oh, I have a PhD that will help me out. I was totally naive. And then, of course, I didn't get in the first time. Then I said, oh, just maybe I'll just go in the second time. I applied the second time to more schools. I thought just more schools. I actually had two letters of recommendation from two Nobel laureates, but no one at that time ever looked at my letters of recommendation. So that was the second time, no interviews, nothing. So then, and really the school I wanted to go to at that time, there was at the University of Miami, there was a PhD to MD program, which was 2 years. So you would save 2 years basically. So then the third time, some people told me, look, maybe you should take the MCAT again. I mean, my score was okay, but I think it was my GPA that was just a killer. So I took the MCAT again, and I did pretty well. And then all of a sudden, I was getting interviews right and left. It was unbelievable. But the school I really wanted to go to was University of Miami. Fortunately, they interviewed me and I got in, and that's how I ended up going into medicine. And in the beginning, because of my PhD work, I thought I would want to do oncology, either surgical oncology or medical oncology. In fact, when I applied for residency, because it's a 2 year program, you don't have too much time to think. So I applied to both medicine and surgery because I didn't know exactly what I wanted to do. And then as time went on, I actually wanted to do surgery. But I got into, when I put my choices, I put a couple of internal medicine, a couple of surgery, and I got my seventh out of the choice, which was internal medicine at UC Irvine. So I was a little bit bummed because I wanted to do surgery. So, and actually, I ranked my program, University of Miami, they ranked me so I would get in, but I put them number 10, so I didn't even get to surgery. So the program director said, oh, just apply again. We'll take you, go do a year of internship. It will make you a better doctor. I said, okay, that's great. So meanwhile, I thought I was just going to go back to Miami and do a surgical residency. And then meanwhile, I really enjoyed internship, just internal medicine. It was great. So I wrote him this long letter apologizing profusely, and I stayed in medicine. Initially, I wanted to do oncology, but I did a rotation in GI during my residency, and I loved it. And I thought also I could actually apply some of what I learned in my PhD because I knew I wanted to stay in research while seeing patients. And so that's how I ended up in GI. And then in terms of being involved with the AGA, that was the second part of your question. Um, I During my fellowship, it was expected that it was actually great. We had a privilege to come to DDW. So AGA within my fellowship was the major society, although others could pick any GI society they wanted. So um, I I would just sort of meet people and say, oh, why don't you join this committee or that committee, and that's how I ended up. And then as I joined the different committees, I realized what a fantastic opportunity, networking, actually keeping what's going on within our discipline. So that's it's very simple if you know what to do.
So what made you want to be president of the AGA?
So that I never ever thought. I just thought I will just be a committee. I never, because the president line was more this governing board thing, which I never really quite understood. I never really thought about it, but I think it became more as I got more involved. Probably the turning point to think about presidency was when I served as editor of Gastro, because other members of the editorial board, actually a couple of past editors, suggested that, oh, why don't you just throw your name in the hat uh, uh, for AGA president? And I actually didn't know that much about it. I mean, I would go to the plenary presidential session and so on. But I think one major influence, I would say, was Emmett Keefe, because he was past president, and that was at that time I was a faculty member at Stanford. So he was very encouraging of all the faculty, and I became division chief. So I was actually technically Emmett's boss, but he was really my boss in reality. But so it was really like that in terms of to try to be more involved and really appreciate what the society offers in terms of service, in terms of learning, in terms of it really impacts your daily job, how you kind of carry on your regular job. So
So, you've recently been a president.
yes.
And my question to all the presidents is what they recollect from their time, excuse me, in office. And I'm going to ask you that too, even though it's much more recent memory.
So you asked me the question is what's it been like this year as this past year actually serving as president between 2020 and 2021. And I didn't really know when I first started the presidential line initially as vice president and president elect and president. Um, I of course I was watching the presidents who became presidents behind me, and the immediate president behind me was Hashim al-Sarraj, and then before that it was David Lieberman. So, and I knew them very well beforehand. So, I was kind of trying to learn the ropes, see how they conducted meetings and so on. But then things, of course, totally changed for everybody. And that's when, of course, when we have the pandemic that came, and that was in March of 2020. And so Hashim got the beginning of the pandemic. And then my service started, let's say, May, June of 2020. And I was sort of right smack in the middle of it. Not just me, I was like everybody else. Everybody didn't know, had to really compensate and react and act. And so for me, it was like, it was nothing that I saw David Lieberman or Hashim kind of deal with. It was something totally new. And in fact, I don't think it was anything that anyone thought, what they're going to do. So it was really more, I was really one of a member of the team, the governing board, the staff of the AGA, who were absolutely incredible. And we kind of, I think we just all lifted each other up. I mean, that's really what it was. And I was, I mean, on reflection, I was incredibly proud. It was one of the most, gratifying things I was involved with, totally, everything that I've done so far. Just in terms of how everybody really came together. I mean, certainly at my institution, the day job, it was similar, but in a different kind of a way. But in fact, some of the things that was applied at AGA, that AGA did, I was able to kind of pitch them in some ways for my regular day job. Some of the things that were done in my day job, I was able to bring back to the AGA, say, what do you think? Let's try this, let's try that, and so on. So it was just unbelievable. And the best part of it is that it's a happy ending. I mean, hopefully the whole pandemic is going to be behind us. Hopefully, uh, but it's not over yet. Obviously, people unfortunately are still dying, and no one really knows the outcome. For example, this thing called long COVID. It depends what happens with that, because there are so many people who are infected. Of course, they recovered, but there is this possibility of long COVID, whatever that really means. So
So, how do you think you left your mark on AGA as president? And I also want to give you the opportunity to talk about the AGA Equity Project.
yeah. So the question is, how did I leave my mark on the AGA, and to talk a little bit about equity project. Um, I would say it's the other way around. It's the AGA left its mark on me rather than me leaving my mark on the AGA, because really it was the AGA offered the opportunity to be involved in activities that kind of serve the major goals of the AGA, and that's research and innovation. It's maintaining the ability of the practice of GI. It's really membership, communications membership, growing membership, and also making things better for patients. That's really it at the end of the day. So, in terms of the providers, the AGA did a fantastic job um, um, in terms of during the pandemic providing guidelines. I mean, that was huge because no one really knew what to do. You have to kind of react based on the best data that you have. So it was really important to collect that data, put that data together, and come up with some sort of recommendation. So that was, I thought, it was really just humbling to be part of this effort. The other part is there wasn't really just one pandemic. Unfortunately, there were other kind of could be called pandemics in some ways. One is kind of at the national level, of course, is the realization about um, racism and the impact of that, and also what the pandemic had uncovered, and that's in terms of health disparities. Because unfortunately, the folks who were impacted the most, whether infection, hospitalization, unfortunately, death, were those folks who came from underserved communities in general. So, so that I think that was really kind of it was a landmark sort of awakening, if you will, for AGA in terms of realizing, hey, we can do something about this. And that's where the AGA, I thought, stepped up in a way that I'm sure all medical organizations have stepped up, but I don't know what would be the comparator, but I'm so proud. I think it would be hard to say that AGA weren't among the leading, if not the leading organization, certainly within medical subspecialties. Um, and part of that dealt with something that we call the Equity Project. And that really started both because of the pandemic and what it unfolded, but also because it was growing nationally in terms of racism and George Floyd at the time and many others who were unfortunately killed. Um, and initially, a task force was established. Just very briefly talk a little about the history of that, and in terms of how do we, what are the things that are actionable, and that was really a key word, is actionable, that we can do. And the other facet of this is what did we do internally within our society, within our organization, and also what can we do outwardly in terms of with the providers, with our members, and also how our members can help interface also with, for example, the patients that they deal with, providing more access, things that we can do for telemedicine, things of that sort. So there's a lot of aspects to it, also that dealt with advocacy and so on, and education, information. Um, and that task force made recommendations very quickly. They met regularly, like weekly, and presented some options for the governing board. And the fantastic thing about this, being a member of the governing board, is that the governing board embraced all the recommendations. And then that became a so-called equity project, and it's just unfolded in a huge way. And that's it's I, I don't know if project, I don't know what the right word would be. I don't know if it's much more than a project. It's really a lifelong effort for everybody, and hopefully it will, I think it's been embraced by many, but hopefully the impact of that will help others embrace it as well, and also build on all the things that have happened. So
What impact has leading AGA had on you personally?
um, I think personally, maybe from the family perspective, maybe I wasn't as available as I would have otherwise. But I think I have a lot of support from my wife, and we have a son and a daughter who are going to college. So I think they're in some way activists, so they really appreciated kind of, because we will talk a little bit about what the AHA is doing and so on. So I think it was nice to see that they actually agreed with what I'm doing for once. And But it was really also, I don't know, it's hard to describe because it all kind of it was what was happening at the AG, but what was happening also in my regular job, and they all kind of intermingled. And it taught me, I think, to some extent, how to multitasking is always a good attribute to have, but I think it taught me even more about multitasking because I felt it's almost like you're on call, like being on the wards or something like this. But it was really it was nice to see that things that were being done by the AGA were really seemed to be making a difference, and in fact, I would say were making a difference.
Could you share your thoughts on where AGA is today?
Today, I would say AGA is a leader within the GI societies, uh, and it is highly respected by whether it's members of the AGA. There might be gastroenterologists who are not members of the AGA, but they're gastroenterologists. But I would say, I mean, I have some of those who are my friends, and in fact, some of them I encouraged to join the AGA, and very few of them listen, and they did join the AGA, and they might be member of the other major GI societies. But I think the AGA's work, one could look at it, is that it really is just beginning, because a lot of things have changed because of COVID. Many practices, in fact, have suffered because of this. And also, the care for patients, if anything, have gotten access to care, particularly, has not has gone backwards. Some people would argue. And in addition to this, also, it became more apparent, that the health disparities has really become totally unmasked because of that. And so the AGA has an opportunity to try to uh, really make an impact in all these different areas. And also, we have GI diseases that are still unfortunately killing people. So, and one big effort that I'm just on the tail end of this, just as I'm stepping out, of course, is the screening for colon cancer and colon cancer in general. But there are also other GI cancers. And I think one of the great things about the specialty of gastroenterology is that it offers opportunity for prevention, it offers opportunity for diagnosis, but it also offers opportunity for therapeutics. And it's not pharmacologic forms of therapeutics, but actually almost like surgical interventions in some way. And that's really one of the cool things of the field. And now you can layer on top of it innovation, because a lot of things are happening in that sphere. I mean, artificial intelligence is just a cliche kind of a thing, but that's going to be, now people are calling it AI. I think most people know what AI is, but some people don't. But AI is just going to be, I don't know, very, two common letters. So I think there's a lot of exciting things that the AGA could really be involved with. And I know, as I'm kind of saying goodbye to the governing board, that those are active areas of discussion, and there's some exciting plans moving forward. So I'm very excited personally about the future of the AGA.
So, a question about what you would and what advice you would give to younger people who are considering a career in gastroenterology.
I think one of the things for careers, it doesn't really matter whether it's gastroenterology or any subspecialty, is really to try, if there's opportunities, to have access to some folks who are really in that specialty or subspecialty, or whatever area it is, and to try to see, what is it that gets them all excited and passionate about this. The other thing also is to try to be involved in some way, whether it's shadowing a gastroenterologist if you're a student, whether you're not sure whether you like research or not. Try to be involved in the research, because, in fact, at the very least, it might help you advance, because you're doing scholarly work that can help you advance being accepted in medical school, residency, and so on. But I think I was certainly surprised. I mean, I never thought I would be a gastroenterologist. And so I think, kind of being open to trying things, whether it works for you or not, it really doesn't matter, because at the end of the day, it's actually going to be beneficial, and one may not realize. I certainly now, on reflection, I appreciate things that didn't work more than I did at the time that it happened. So what I would say is, I'm of course biased being a gastroenterologist, but it's just a wonderful specialty because it offers a whole spectrum. So if one is interested in being a doc of some sort, then it's really a great subspecialty. You'd have to become a specialist and then a subspecialist. But at the end of the day, uh, I guess the bottom line for me is, would I do it all over again? The answer is absolutely yes.
Is there anything else you'd like to share that I didn't cover?
No, well, first of all, I just want to say that uh, being part of this celebration is awesome. 125 years, it's just, it has a nice ring to it, but also it really reflects 125 years. I mean, the society, it's the first GI society, period, globally, which is awesome. It's stuck with it for 125 years, and it's still leading, which is also awesome. It offers so many opportunities for the members at all levels, the levels that kind of we touched on a little bit. So I just want to say, I guess it's a birthday. I would be waving the balloons and so on. So I would say happy birthday, happy 125th AGA, and I will also say it in Arabic, Mabruk Eid Milad Saeed.
Thank you.